get my message about turning in the labs?
When did you send it, Kayla?
Like 1 or 2 days ago. I've just been having problems trying to submit it, and it's just like a scanned PDF of the page.
Yeah, that should be okay. Everything's open. I think I emailed you yesterday. I know I read your email yesterday. The assignment is open. The only thing you would see, because it had a due date on it of last Thursday, would be you might get a late message. But
I assume those were due this Thursday at midnight. That's what I had entailed from the first day of class.
No, the labs are due the day of class, because if you were here in person, you would be doing the lab that day.
Okay, I guess I misunderstood because that was the first day of class and I didn't think we were going to have something due midnight the first day of class.
Yeah, but it's okay. It should still, when I looked yesterday, the assignment was still open. So you shouldn't have any trouble getting into it and submitting the PDFs. Are you not seeing it, or what's the problem?
I'm seeing it and I'm clicking where it says browse computer, going to where my USB file is, and my PDFs are saved in my USB, and I'm trying to take it from the USB to Blackboard, and it's not allowing me to submit it at all.
Okay, that's going to be a Ellen Gardner or John Erdman question. So you'll need to call that distance education help desk number that's on your welcome page of your Blackboard.
Okay.
Because I don't know why it wouldn't accept a submission. Are you on a Mac?
No, I'm just on one of the normal library computers trying to do it.
Yeah, so then I'm not sure what the problem would be. That's above my techie knowledge, Kayla, sorry. Worst case scenario, you can only attach one thing to a Blackboard email. Send me 2 emails with an attachment on each one. But see if Ellen or John can help you first.
Okay.
Okay?
Yes.
Okay, so we're going to finish. All right, so we were looking at healthy levels of body fat and unhealthy levels. We looked at the data from the study looking at the 3 groups of men that indicated that you lose the most amount of fat if you combine decreasing your calorie intake with aerobic and resistance exercise. Okay. Just a quick mention about athletes. So typically athletes have lower body fat percentages than the normal population. But that doesn't mean that it's okay to push those lower limits that we had on that chart. All right, men really shouldn't be looking to be less than around 5. I know it said 3 to 5, but 3 is very, very low. I mean, like being able to see your lymph nodes in your groin low, right? So I think 5 is a good, and then 14 for the women. And the different techniques, and we'll talk about these tomorrow, the different techniques to measure body composition and body fat percentage all have...
Someone's raising their hand. Said? Abraham?
Ibn.
Yeah, they're raising their hand. I don't know.
Oh,
Sorry, Doctor.
that's okay.
I'm still in chapter 13.
Yes.
Okay, thank you.
So using different techniques, all techniques have a measure of error within them. So different techniques will have differing levels of error, you'll get differing results on body composition. So we'll talk about this again tomorrow. It's important that you use the same version of measurement over time, right? Otherwise you're kind of skewing your data. And think about the fact that not all athletes will perform at their absolute best at low percentage body fat. You know, for some people that just does not feel good. Now that doesn't mean that they should be, you know, up in the high teens and 20s, but you know, you're not going to get everybody to the same body fat percentage and get a good performance. And remember that athletes in different positions are going to have different body composition, right? So for health, I think men typically, they say for health levels should be about 15. So your male athletes could be, you know, anywhere from 12 to 5. And for women, it's 25% on average. So your athletes will be probably 22, 23 down to 13 or 14. Okay? So if we think about different types of sports and different positions in those sports, I think last week I used an example of different positions in football, but here's a good one with sport acrobatics. If you've ever seen any sport acrobatics, it's a really fun sport. And you can have pairs or groups, and typically the top person in the pair is quite a bit smaller than the base person of the pair. So, you know, it would be very difficult to compete and create this kind of movement if they were both the same size, right? So we have to allow some flexibility based upon the person's somatotype, which the book goes into in this chapter. That's a new piece in this chapter. We'll do it later in the semester, and I'll pull that piece out. Okay? Right. Have a look at table 13.5. And there's a table of athletes with their average body fat percentage for men and women. So tell me who on that table do you think is at an increased health risk? Which sport has an increased health risk? Okay, well, you can have a look at that this afternoon and think that through. Okay. So remember that when we're looking at performance, body composition is one factor of performance. All right, now it's an important one for some sports more than others because you don't want your athletes to get hurt, right? But just kind of try to be a little flexible with your boundaries when it comes to body composition. Okay. All right. So one of the interesting things we see is some changes in appetite with physical activity, particularly hard exercise. So an acute effect that we see for most individuals, not everybody, there's always, one of the frustrating things with exercise physiology is there's always someone that does not meet the picture that is typical, right? But for most people, the acute effect of exercising is a decrease in appetite for a short period of time. So you might have experienced that, you work out really hard and you know you need to eat, but you can't kind of face the idea of eating for a while. It takes an hour or so, and then you can go, oh, now I can have something to eat. Okay, so that decrease in appetite can occur for a number of reasons. It could be elevated catecholamine levels in response to the exercise. So epinephrine, norepinephrine, cortisol, right? Those all rise in response to exercise. And it could be the elevation in body temperature, right? We all know that if we exercise, we get warmer. So those elevated catecholamines and the elevated temperature can affect the hypothalamus in the brain. And the hypothalamus is responsible for controlling appetite and the feeling full, satiation idea, all right? So it could be that, until the temperature drops down and until the blood levels of these catecholamines drop down, then your hypothalamus is kind of giving you a signal that you're not hungry yet, okay? There's also changes in hormones due to exercise. So ghrelin is responsible for stimulating appetite, and we see a bit of a depression in ghrelin. Leptin is responsible for suppressing appetite, and we see a bit of a raise in leptin. And also insulin can be a factor because it's it's released into the bloodstream to help move glucose out of the bloodstream into the muscle tissue, but then it kind of messes up your feelings of being hungry. All right, so that's a short-term effect that might happen, and it's important, as we'll see later when we talk about nutrition and the impact of nutrition on muscle growth and carbohydrate storage. This particular effect can impact that protein and glycogen synthesis. So we'll have to talk about some ideas to circumvent that, right? What are some strategies we can use? Now, in the long run, what happens to appetite is that we see an overall increase over time, all right? Because you're expending all these calories. So if you go back to the idea of our seesaw, right? You're spending all these calories exercising for a few hours. If you want to maintain your weight, then you need to eat those extra calories to keep the seesaw balanced, all right? So the harder you work, the longer you work, the more hungry you tend to be, right? So I'm sure that a lot of you have experienced that. On days when you train really, really hard, then you could eat a horse, right? And on days that you have a lighter training session, then you're not so hungry. Or when you're on break over the summer, right? Maybe you're not as hungry as you are when you're at college, for example, right? I know when I was weightlifting very heavily and we were training like seven or 8 sessions a week, I could never eat enough food, right? I was always hungry. It was a joke in the family that if anybody couldn't finish their food, it was okay, just give it to Sarah and she'll eat it. Can't do that anymore, which probably means I'm not moving enough, I suspect. So we want to make sure that we're doing this sensibly, that we're thinking about the science, that we're using that information to change our body composition in a sensible manner, okay? We talked earlier in this chapter about the fact that often when people say they want to lose weight, what they really mean is they want to lose fat mass. Most people aren't looking to lose fat-free mass, so muscle or bone mass, right? Because it's important to keep muscle and bone mass up as high as we can, okay? And once we've lost the fat mass, then a crucial goal is to maintain that loss so that we don't have this yo-yo weight loss, put on weight, weight loss, put on weight, and the yo-yo dieting that tends to go with it. So we have to do it slowly, right? And the recommendation is to look for 1 to 2 pounds a week, right? So if we again think about our seesaw, right? And when we were looking at the energy balance, we said the key is to create a deficit between the calories coming in and the calories going out. Right? So a pound of fat has 3,500 kilocalories, right? Calories. So if I create a deficit of 500 calories a day, that equates to a loss in fat of 1 pound a week. If I want to lose 2 pounds a week, my deficit has to be 1,000 calories a day. All right? So people get frustrated. I have a lot of people come to me and say, oh, I really want to lose weight, how do I do that? And I sit down and I tell them everything, and they're like, oh, well, I've got to lose it quicker than that. I'm like, well, then I'm the wrong person to talk to, because this is the safe, healthy way to do it, right? But if you think about it, right, 1 to 2 pounds a week means that over the course of a year, that's 52 to 104 pounds fat loss over a year, right? If you persevere and you stick with it. Now, there are always times when you plateau, and that's annoying, right? And you just have to stick with it and trust that if you stick to the program, you'll start dropping some weight, assuming you have weight to drop, and that's another problem that we'll talk about, right? So it's combining both sides of the seesaw to create the deficit and being patient, right? The problem is we're not a very patient culture, right? We want everything now. Everything's got to be a quick fix. And that's a problem, because that isn't healthy when we're talking about losing fat, okay? If a good way to do it is, if you really need to lose some fat mass, try on a pair of jeans or a dress or whatever, right, that's a little bit tight. And then stick it in the back of the wardrobe and try it on again in 8 months' time. That's a good approach. Okay? And that's where we really want to try to encourage our PE students and our athletes, like, okay, but this has to be done in a healthy way. Starving yourself is not healthy. Doing some of these crazy diets is not healthy. Right? When I was 16, I decided all I was going to have all day was black coffee. And you know what? I ended up in the hospital because that ain't healthy. And I did not lose no weight, so it didn't work either, right? But I was 16 and stupid, and I didn't have anybody giving me the knowledge that I needed to help me out, right? So we have responders and non-responders, so you can give two people the exact same program and one person will respond very well and the other person comes back and hasn't got much to show for it. And it's easy to judge that the person who hasn't got much to show for it maybe didn't stick to the program. But that might not be true. They could have stuck to the program very, very carefully. It's just that different bodies respond to different stimuli and at different rates. Okay? So the next two lines I've got in grey, and I know I mentioned this previously, but I'm going to say it again just to highlight this idea. 150 to 400 kilocalories a day expended in physical activity. So if I go for a 2-mile walk and I walk at 4 miles an hour, that's about like 180 calories, right? It's not a lot. It's not a lot. So to expend 400 kilocalories, you're really looking at an athlete or someone who has plenty of time to give to their exercise program. Okay? So bear that in mind, all right? The other thing I wanted to remind you was that the book says on several occasions that a weight loss diet is going to supply somewhere between 1,200 and 1,600 kilocalories a day. That's pretty low. It's not a low-calorie diet. It's not a crash diet. But that is pretty low, and that is not a number you should be bandying around with athletes. Right? There isn't anyone who's training who ought to be on 1,200 calories. Their training plan is going to go down the pan. Okay? So make sure that your athletes are eating enough calories to maintain their workload. Okay. So a question that often comes up is, how much weight do I need to lose to meet my fat loss goal? Right? So if we say that really what we want to lose is fat, not weight, then what am I looking for on the scale that's going to represent the fat loss that I want? If you go to box 13.8, they give you a really nice calculation that you can use to show an individual how much weight, given that they're doing a training program, right? Because remember our data from Monday. If all I'm doing is dieting, then that weight on the scale may not be fat mass, right? So given that they're doing their physical activity program at the same time to maintain bone and muscle mass, what's the weight change that would correlate to that much fat loss, right? Does that make sense? So I have a slightly different calculation that I use, but this one in the book I think might be a little bit more straightforward to follow. And it's a good tool to give your clients, right? Because the more they understand, the more they'll tackle the problem in a healthy manner, right? So if I know that I've got to lose 10.8 pounds, this particular individual, to lose 10% body fat, the numbers don't always line up like that. That's a very convenient example, right? Then that gives someone who doesn't have skin fold calipers or doesn't have a bioimpedance mechanism, right? It gives them something to work with in between the times they spend with you. Right? When we get to goal 2 here, okay, the research indicates that maintaining the fat loss is more likely for people who are going to maintain a moderate to vigorous physical activity program. Right? So again, what we're looking for is a lifestyle change. Right? They come to you, you give them a program, they work for 6 months, they meet their goal of fat loss, and then they say, well, thanks very much. It was worth paying you to do that. And then they go home and they go back to being sedentary or low active. Then it's likely that some of the weight at least will come back on. Right? So it has to be a complete lifestyle overhaul. Right? But you'll want to tackle it a little bit at a time on each side of the seesaw, because if you hit one or the other side too hard, then they quit. So we do have athletes who resort to crash diets. Crash diets are typically considered, I think maybe like 800 calories or less. And we have certain sports that are more at risk than others. So weight class sports, powerlifting or something like that, anywhere, or maybe boxing where I get weighed, and that determines which group I get to compete in, right? So that's always a problem. Sports where how I look count for some of my points, right? That can be a problem. So gymnastics, diving, ice skating. Sports where the uniforms are very skimpy, right? And getting skimpier by the year, it seems to me. Maybe I'm just getting old, I don't know. But like the beach volleyball bikinis seem to be getting smaller and smaller. And the sprinting leotards are getting smaller and smaller. So, you know, volleyball, the shorts are getting shorter and shorter, right? So though any sport where the outfit is relatively clingy and skimpy, all of these sports are at risk for, they're all athletes that you've got to keep an eye on, you've got to educate them. They have to understand that a crash diet not only will not work to meet the goal, right, of losing fat mass, because a crash diet sends my body into dropping metabolic rate because it thinks it's in trouble, right? So it doesn't work for the goal, and more problematical in the short run is that it's going to have negative physiological consequences, and their training and their competitive performance will go. Okay. So one of the problems with that kind of diet is that typically the individual will become dehydrated to one extent or another. And the first reason for that is that glycogen, which is storage form of carbohydrate, is stored with water, right? So a lot of people, when they go on these severe diets, go, oh, carbohydrates are so bad for me, I'm just not eating carbohydrates. And they love it because you get on the scale and in 5 days you lost 7 pounds, right? But you didn't lose 7 pounds is the problem. What you lost was a whole pile of stored water, and water is very heavy, right? If any of you hike on a regular basis, you know. Water weighs a lot. You fill up your backpack thing with 3 liters of water, it's like a stone on your back when you're going up a hill, right? So you lose all this water and you think you lost weight, right? And so it perpetuates the problem. If you get dehydrated to around 3 to 4% of your body weight, and you're an aerobic athlete, then that aerobic performance is going to be affected quite a lot. You only need to dehydrate about 1% to affect what's going on in here, right? So if you're a student and you're trying to learn, not a good plan. If you're an athlete in a sport where there's a lot of strategy involved and you're not concentrating properly, not a good plan, right? The actual aerobic performance by 3% is starting to see a drop in performance. Okay. How much drop in performance depends on the individual, depends on which event they're involved with, right? It's not the same extent depending across the board. It depends on the sport that they're performing in. And we have a whole chapter on fluids and electrolytes coming up later in the semester. So we'll talk a lot more about dehydration. Okay. Questions? No? All makes sense? All right, so you may have heard of a particular condition that's been labeled the female athlete triad. And this is a syndrome, it's an umbrella term for 3 different energy-related variables that can feed off each other, right, and interact. So the first one is menstrual cycle irregularities. So you may have an athlete who typically menstruates normally once every anywhere from 25 to 35 days, right, and then stops. Okay, that's not normal. So she's either pregnant or there's something skewy with her energy balance. All right. The next problem that builds in is bone density issues. So when we don't eat enough calcium, and often when athletes diet, one of the things they cut out is things like milk, cheese, butter, yogurts, right? Because their animal fats are seen as not very good for you. So they stop eating those. Well, if your body is not receiving enough calcium through your diet, guess what? It has a whole skeleton full of calcium. It can just leach it out, right? And that's what it will do. So if you don't give it calcium, it starts to steal calcium from your bones. And that can lead to, level 1 is called osteopenia. Typically you see that in the heads of the femurs or in the spine, sometimes in the wrists, right? And then level 2 is osteoporosis, where you've got these great big gaps in the structure of the bone, right? So the framework of the bone gets very brittle and very weak and thin, okay? Which setting you up for an injury, right? And then the last one is reduced energy availability, which can be with disordered eating or just because they're falling into another group. So they could have an eating disorder, which to have an eating disorder clinically diagnosed is tricky because you have to be pretty bad. And first you have to identify that the person has it, and then they have to admit that they have it, and then they have to go get help. But the criteria, so for example, for bulimia, the criteria is something like that the individual purged a minimum of 3 times a week for the past month, right? Well, okay, but if I have someone who's purging twice a week, that isn't okay, right? But it doesn't meet the clinical criteria for bulimia. So you have to approach this quite carefully. Then there's disordered eating. So in disordered eating, it means that the individual has these weird isms around their food, right? So they don't eat normally, but they don't meet any diagnostic criteria. So they refuse to eat potatoes if they're out with the team, right? And they won't eat potatoes if they're in front of somebody, or something like that, right? Weird little disordered eating things. Or they don't eat breakfast, and they don't eat lunch, and they only eat supper, right? Things like that. Not a normal eating pattern, okay? And all of these problems relate to body composition and diet, your nutritional intake. And they can result in decreased performance, they can result in injury. They tend to clump together because they are all linked to this idea of a reduced energy intake, right? We're not qualified to deal with that, right? When you graduate with this degree, that does not make you a nutritionist or a doctor, right? If you have a student in your class or a client or an athlete who you think might be exhibiting some of these problems, then you need to try to get them to go and see someone who knows what they're talking about, right? That can be the biggest problem because they won't admit that they have an issue. Okay. So not having enough energy available for the level of work that's being done seems to be the key problem. So the menstrual cycle stops because the menstrual cycle takes a huge amount of energy each month, okay? And the body will just stop anything that isn't crucial to keep you alive. So if it's not getting enough energy in the form of nutrition and good food, then it just starts going, okay, we don't need that, we don't need that, we don't need that, and the menstrual cycle gets kicked out, right? So it's linked to this idea of reduced energy availability. Osteoporosis or bone mineral disorders, very similar, particularly if the reduction is in calcium, phosphorus, magnesium. And then the eating disorders calorie intakes, okay? So it doesn't have to be an eating disorder, but it might be, okay? So the two big eating disorders that you'll have heard of are anorexia and bulimia. Someone who is anorexic will just refuse point blank to eat enough food. They often obsess about exercise and using calories, so they won't eat any calories, and they'll just do, you'll catch them in the middle of the night. They'll get up in the middle of the night and they'll be in their bedroom doing sit-ups and push-ups and step-ups and things, right? They're absolutely off the chart obsessive about moving. Bulimia nervosa is a situation where the individual will often binge eat and then they'll purge to get rid. So they'll take the food in, but then they'll use some purging mechanism to get the food back out again before it's digested properly, so that they get to eat it, but they don't have the calories, right? So I have a few more characteristics here because of my background. I knew lots of people who were anorexic and or bulimic. So they're both, so one of the things that it's important to understand is that once an individual has got to this level, it's no longer just a physical disorder. It's now a psychological disorder, and they need psychological help to get healthy. You telling them that they have to put on 5 pounds before they can come back to training is a complete waste of your time, right? You have to understand they're not in control anymore once they're at this stage, right? So an anorexic has a very odd view of what they look like. I read this years and years and years ago. There was some work, and they would give they'd stand someone who was anorexic in front of a mirror and give them a crayon and say, okay, draw your outline. And the drawing on the mirror had no representation of the person doing the drawing, right? They would draw this round kind of, very, very strange. They're absolutely petrified of putting on half an ounce, and they will be amenorrheic because their body just doesn't have any energy to waste on a menstrual cycle. Okay? So often they'll wear very baggy clothes to try to hide how much weight they have lost, and sometimes they'll be quite proud of the weight they've lost, and sometimes they'll be really mortified and embarrassed, and they'll try to hide it from you, right? So there's no kind of regular picture. I mean, everybody's different. Bulimia is a little bit harder to pinpoint if you're not directly involved with that person. So bulimics will binge eat, so they'll eat like anything that's around. And so it's difficult if you take your athletes out for pizza once a week and you have an athlete who eats 4 slices of pizza, then you're like, yeah, this person is eating, they're healthy. You don't know what they're doing after the 4 slices of pizza, right? Again, because it's psychological, sometimes they will report that they just don't, once they've started eating, they don't feel in control, and they can't, the binging, they can't stop the binging once it's started. And then we have purging behaviors to pick up on, and there can be several types of purging behavior. The one that most people know about is sticking your fingers down your throat and making yourself sick. So your athlete who eats 4 slices of pizza, does she immediately go to the toilet before you all leave the restaurant? Right? So stick your fingers down your throat, make yourself vomit. That's one purging behavior. Using laxatives, like masses of laxatives can be a purging behavior. Drinking salt water to make yourself vomit can be a purging behavior. Right? There are different types of purging behavior. You just have to catch the one that they're doing. Now, if they're vomiting regularly, there's a couple of things that you can look for. Is that the acid in the vomit will rot their teeth, and people will have very bad breath. So that's a kind of clue to look out for from the vomiting, from the purging behavior. You know, do they always disappear after they've eaten something? You know, it's difficult, right? I had a friend at college who was anorexic, and she would only eat carrots. Right? Carrots are very high in keratin, which is a precursor for vitamin A, which is stored in fat. So her hands turned orange. It was very peculiar, very sad. I mean, she was not healthy, you know, she was very unwell. So this is a new diagram in this edition of the book, and quite honestly, I haven't looked at it as closely as I had hoped I would have time for today. So, but I like this idea that this idea of low energy availability, for whatever reason, right, may now be referred to as relative energy deficiency in sport. So that is going to lead to decreased glycogen stores, decreased muscle strength, decreased endurance, performance. Go back, right? So we've got all these variables that we can keep an eye out for, even if we can't identify some disordered eating at one level or another. Right? There are other factors now that they're clearly linking to this concept of having too little energy for the amount of training that you're trying to do. And so we can look for some irritability, right? That's a good one. So if you've got an athlete who's always fighting back or is having arguments with the teammates, right? And it's important to understand, although they call it the female athlete triad, these eating disorders in particular are being seen in young males as well. So high school level in particular, I'm not so sure about college. I haven't read much about college age athletes, but high school athletes, males they're starting to find eating disorders, anorexia, bulimia type, and disordered eating in that population. So don't just assume that this is only a girl's issue, right? And then the last little bit, just to finish on a sad note, but no, just to show you the impact that coaches and people in charge can have, right? Because that's who you're going to be when you go out. That you need to be really careful of the language that you use when you are trying to suggest that an athlete might need to lose a couple of pounds, right? So this story, as you can see, is quite old. But I think it's relevant, particularly because of the change in gymnastics over the last 20 years. So this young lady was a very good American gymnast. American gymnastics was not at the top of the world team tier like it is now for women. They were hovering around 4, 5 regularly. They would kind of flip-flop 4 and 5 with the other team. And they went to the World Championships in 1989. And this young lady, so I don't know what you know about gymnastics, but they do like an overall event, and then they pick the top 6 people on each piece of apparatus to do individual events. So she made the top 6 for her asymmetric bar routine in that team event. And so she got to compete in the individual bar title. And she placed 4th. This was huge. Like, American gymnasts never won medals at the World Championships, right? And they didn't very often even make the top 6. Okay, it was Romania, Russia, China were just coming in, East Germany, right? The Americans never got this opportunity. This was a big deal that she did this, okay? So she's like all excited. She wanted to go to the Olympics the next year, and that was her goal, was to work really hard and go to the Olympics. And she was at a training camp, Olympic training camp, and one of the judges that was at the camp told her that she wouldn't make the team because she was too fat. Right? And so, of course, she wanted to make the team. This was her goal, right? So she's like, fine, I'll lose weight. Okay? So she started losing weight. And she kept losing weight. And in the end, she was about 95 pounds when she came 4th in 1989. She died in 1994 at 47 pounds. 47 pounds. Now, she was only 4'11". I'm 5'3", so she was only about this tall. Right? 47 pounds. So this was awful. It was horrendous. Very, very sad for her family, obviously awful for her. She never got to achieve her goal of the Olympics. And the thing, though, that I think came out of it, if you could say any good came out of it, was that American gymnastics as a group, forget the whole doctor thing that was going on last year, but American gymnastics as a group went, okay, we have to change our approach to what we expect our gymnasts to look like. And it changed, I think, gymnastics across the whole world, because the Romanians at this point in time got lemon water all day to drink and 1 meal in the evening. And they were the best gymnasts in the world at this time. Right? So that's not a way to treat your athletes. So, ta-da! It's very sad that Christy Henrik died, but I do think that it made people sit up and take notice. So, questions? I'm late again, you've probably all left. Oh, no, some of you are still here, well done. Any questions?
No, not good.
No? Okay, so today's Wednesday. Friday we will start chapter 2, I believe. Okay? I do have office hours this afternoon. If anyone has questions, you can come to office hours and I'll be there. Ooh.